Hello, my name is Gabrielle Smith, and I am a second-year medical student at Oklahoma State University College of Osteopathic Medicine. Today I will be presenting our findings on a novel emergency medicine simulation addressing high-risk scenarios with fire first responders. The CDC reported 398,000 fire or burn-related injuries in 2021, along with 252,000 injuries related to hot objects or substance. This novel interprofessional simulation with paramedic-trained firefighters and emergency medicine residents was created on the belief that physician residents would benefit from a better understanding of the pre-hospital identification, assessment, and treatment of trauma and fire-related patients. The Accreditation Council for Graduate Medical Education, or ACGME, recommends simulation to teach, observe, and assess and provide feedback for learners regarding patient care and procedural skills, interpersonal and communication skills, and medical knowledge. This study presents the framework for designing and implementing simulations, which remains a valuable tool in education, with positive effects on knowledge, skills, behaviors, and patient outcomes. Pre-hospital care typically requires decision-making without the safety net of equipment and resources typically available in the emergency department setting. Simulations not only improve performance, but also deepen the understanding of pre-hospital care for those not regularly involved in such scenarios, such as the emergency department residents in these fire scenarios. Emergency medicine and fire program leadership collaborated on the development of the simulation, and this collaboration ensured commitment for all programs to ensure an optimal learning environment. Participation was a mandatory component of the emergency medicine residency didactic training and was primarily focused on training in a smoke-filled structure rescue and resuscitate scenario, a confined space rescue and resuscitate scenario, and a fire hose dynamics demonstration. Fire leaders oriented emergency medicine residents to the space, provided field techniques used to stay safe in extreme situations, and divided residents into teams. After completing the identification and rescue portion, the emergency medicine and simulation faculty led the resuscitation portion. When the scenario concluded in field stabilization of the patient, coding the case to the local emergency department, and loading the patient onto an ambulance, the scenario was debriefed by all overseeing fire and emergency medicine providers, and evaluation was determined by feedback. One learning point from the evaluation portion is while informal evaluations are useful, future events should incorporate a more comprehensive evaluation to assess the learner's knowledge and understanding of interprofessional work, such as surveying the participants for satisfaction and knowledge retention. To our knowledge, at the time of this publication, this is the first study to provide a framework for this simulation and can be implemented to help other programs teach their resident physicians. Rural physicians often have broader scopes of medicine and are responsible for managing advanced, demanding, and emotionally charged cases until transfer to tertiary care can be arranged. A deeper understanding of pre-hospital scenarios, potentially provided by a simulation such as this one, could enhance their ability to respond effectively to fire-related emergencies. In the future, simulation experiences that are incorporated into the emergency medicine residency curriculum should add seminar sessions to address learning gaps identified during these events. Depending on the training environment, junior residents may benefit from a seminar in the first block to provide them with basic knowledge, while the senior residents may benefit from a seminar in the second block to reflect on any learning gaps. Simulation exercises should be designed to meet the differing educational needs of residents in different stages of training. Including residents during the planning stages of the simulation would improve the flow of the event, as well as how to best evaluate the effectiveness of education gained. Despite the limitations, this study provides valuable insight into the development and implementation of a novel simulation event and can serve as an adjunct to the emergency medicine residency curriculum. Thank you for your time and attention. I look forward to further discussion at OSU Research Day. A special thank you to my mentors and co-authors for their contributions, and Matt Bernard for his photography at the simulation event.